Uh, oh, here we go again.
Yeah,
Preparing,
there we go.
bro.
Yes,
We're live, bro.
live. Aloha,
Uh,
everyone.
we are live. We are live, Charles.
How do I look, bro?
You want us to comment on that?
Yeah, there we go.
You want to comment?
Some people said that I seem dark on the first time I moved to my new studio. So I think I get enough light now.
They're on your glasses.
Aloha,
you know,
everyone. Welcome on
They're
this
on your
beautiful
glasses.
Monday. On this beautiful Monday, here on Mel and Charlie Live. Yeah, yeah, yeah.
Hey, how come you don't glare? You have a mask on?
Patsy's asking, how come you? She says you yelling glare on your light.
Yeah, because it's connected to my glasses.
Can you please take it off?
This is
Uh,
my right here. This is this is my high powered.
yeah, high powered kind of.
Oh
Oh,
God, please
we
don't
gotta.
laugh.
We better be careful. We better be careful because sometimes people get upset when we laugh on this show.
Yep. Oh, yeah. Tell me about it. Tell
Yeah,
me
I
about it.
cannot show.
we don't wanna. We don't wanna. Tom says it's all about the lighting. Oh, I gotta tell you, Charlie, it's been a
Woo.
long day, bro. It's been a long, long day.
Tell me about it. Tell me about it.
Well, it's just been a long day. And first of all, I posted about that 11-year-old boy that was missing, and thanks to everybody on Facebook. I think when I saw one of the posts had like 53 shares. I think we had over 100 shares. He has been found, and he's with mom. Everything is good. So thank you all that took the time to share that post. I'm sure you all saw it. Thank you so much. It's 11 years old, man. And it's he just had a little spat and decided to go journey on his own. And the kid loves fishing and the outdoors. So he would have done fine outdoors, but as a parent, you don't want to you
Yeah.
don't want to ever go through that. So thank you all that took the time to share it. And that's the power of social media.
Yeah.
Social media can be a good thing, social media can be a bad thing, but when you need to get the word out to Tyson.
What Tyson did
Yeah,
say?
stop laughing, you bastards. But when you got to get the word out quickly,
Yes.
um, this is an awesome format. So again, thank you. And aside from that, man, it's like, Charlie, we uh we didn't get a guest tonight. We were actually gonna talk a little bit about the elections last night, but we just get so much stuff that happens, with COVID. Lin Fu said, "That's our show. Do what we want."
Thank you, Lee. Well,
Yeah,
let me tell you one thing. I think it's come down to a point where, we have brought on so many really good and informative speakers by way of their expertise. And because we do this show every night, it is rather difficult to try to fill every night with somebody different. That's why you may see mainstream media. They will maybe have, like, they'll reserve one day for someone special because it's almost impossible to do it every night. But we try our best. Tonight, ladies and gentlemen, I told Mel I really want to talk about some of the concerning matters that's happening right now, uh, because it all falls in line in relation to how do we fight COVID. We can do our part, but yet there's so many moving parts to this saga, if you will. And a lot of it, ladies and gentlemen, you folks are doing a fantastic job. I'm gonna tell you that out there, all the viewership. You can tell your friends, everyone that's been complying with social distancing, wear the mask, and sanitize. You've been doing a fantastic job. Kauai, you've been doing a fantastic job. We might have a hiccup here and there, but it's nowhere near Oahu. But golly, when things go sideways and it's not addressed properly, guess what happens? We all pay the price. everything comes to a sudden screeching halt. And I said in a post yesterday that, I really would like to get my life back again, but cannot when all of these things are happening. So that's some of the things we can talk about tonight that I wanted to, talk with you.
I just saw Makala just posted that Dr. Kimball is back on island, so we will try to get Dr. Kimball
Yeah.
on. Remember Dr. Kimball from Utah? He's one of the founders of the North Shore Urgent Care Clinic. So thanks, Makala. I'm definitely going to reach out to him. I wanted to bring him on to be honest, and like I said, we this week we have the Lieutenant Governor coming on Wednesday,
Yes.
and I gotta believe that's going to be a blockbuster because he is not in a good mood.
Yes.
And
True.
we'll basically try to get Dr. Kimmel and other people on. Like Charlie said, it's everybody's busy too. Everybody's busy, and we have a lot of politicians that want to come on, and we don't want to make this a political show, but many of our incumbent politicians have a lot of good things to say,
Mm.
and so you will be seeing mostly from our Senate, from the state Senate, from the Senate COVID committee coming on to share with us. I think everyone got a little dose of the Senate COVID committee at the when they surprised they surprised the Department of Health with a visit last week to go check on the contact tracers. We'll talk about that in a little bit. But before we go on, I just want to say, Charlie and I have been blessed. Obviously, I don't ever believe things happen by accident. I don't know what the heck possessed me to start a Facebook Live. You know, it's not like I thought about calling Charlie and say, "Hey, Charlie, I think you and I can do a real good job with a Facebook Live." That's absolutely not how it went. It says, "Hey, Charlie, we're bringing on the police chief. You want to come on and just hang out with us and share your perspective?" And then it grew to where it is today. And much of that is because of all of you. But as a result of this show, Charlie and I have been we're contacted numerous times per day with information, many of which is confidential that we really cannot share. And it's hard for me to sit here as a Portuguese male to not share what I have in my Portuguese brain. It's very hard for me. And but
Oh no.
no, Charlie, I mean it is hard. It's I want to share what I know, but I know that I cannot.
Brother, you know
People
what's
come.
hard? You know what's hard? You as Portuguese gotta get things out. Me as one Hawaiian, I said, hey brother, I kick you back, just go for it.
Yeah. I respect the sources of information that we have, as you do, Charlie. Charlie and I mean, there's no secrets between me and Charlie, I can tell you that. We share all the information that we have with each other and figure out how the hell we're going to make something productive come out of it. And Charlie and I both have excellent relationships with the state leaders, with doctors. So, like I said, it's just difficult to hold back. But some of the things I can discuss because it is relevant to the discussion, and I think it's important that the people know. From day one, we have been talking about COVID. We've been talking about testing and contact sharing. I mean, contact tracing, about how important that combination is. Never did we say that we only need uh, testing and contact tracing. Never did we say that. We said contact tracing, testing is vital in stopping the spread of this virus. Also, we have been saying from day one to wear your masks, to socially distance, to wash your hands, don't touch your face. We need all of that together to make this virus go away. And we expect our state, Department of Health, to do their part. So I had gotten frustrated listening to the state, to Dr. Park and to Dr. Anderson continuously tell us uh, that basically making us feel like it's our fault. Charlie's reading the comments. No, just accidentally text the confidential info to me and I'll accidentally post it, but no tell nobody.
No, this is the best. This is from I'm not gonna mention name, Raylene Malama. I'm not gonna mention names. She said, when you both do a press conference, Uncle Charlie can do the speaking, and Mel, being Portuguese, you can do the sign language.
Yeah, that probably is the way it would have to be. It really would, because a press conference otherwise would be 2.5 hours long.
Hey, knowing you, brother, I'm gonna stop talking, and you still gonna sign language out of frustration. I go, hey, I never said that, and you gonna keep on going.
Anyway, getting back. So we expect the state to do their part. We expect the state to do their part. And what we found out over the last few days is that there is a huge, huge puka void. There's a huge gap in what is happening. So now we on Kauai, I gotta say congratulations to all the people on Kauai, and thank you. We have been able to keep our numbers down because I think the vast majority of us are practicing safe measures. We have a mayor and an administration that is proactive, that is not afraid to take actions that will keep us safe. I think that collectively, that is why we have a very good report every day. Yeah, we did have a new case yesterday. We had a new case today. Both are travel related, and both are in the same household. So, we've confined it, and we've confined it. The problem we're seeing is that as far as contact tracing, what you saw on the news was that we don't have adequate numbers of contact tracers. Last night, I went and did some research. Love Portuguese. I understand your dilemma, Mel. You're allowed to draw pictures. Okay, now we're going to make this a Portuguese show. I did some research last night. I spent a lot of time last night reading various states' approaches to contact tracing.
Yep.
The one I saw that would be the closest or the most, what I thought anyway was the most realistic, was the one from the state of Washington, and it's a huge report. But basically, they're saying when you're in a flat time, when your numbers are low, you can have 15 tracers per 100,000 people. But once your numbers start to spike, you gotta triple whatever that. But this was the statistic that I swear to God, made my stomach hurt. The average caseload per day per tracer in Washington State is 7. They believe that a contact tracer can adequately, properly trace a contact, and they can do 7 a day. And that is giving each case the appropriate time, each contact appropriate time to make it up. Now, you saw and heard on Hawaii News Now. I watched it again today because I was sharing the video with my friend.
One guy talking to Kidani, Senator Kidani.
Yes.
Yeah.
Well, they had 2 of them. Yeah, Kidani was asking the question, and one of them had 130 something, and the guy had 192 cases. Charlie, that is incredible. And so we know, and it was very clear that day or that night that as we watched that thing on the news, it was very clear that we are not contact tracing. In fact, we're doing the exercise. We're going through the motions, and we're telling the public, giving the public this false sense of security, no worry. But the damage has already been done. You see, and let me just say this, Charlie, and then I'll let you chime in because I know you have a hell of a lot to say about this. When you have a pandemic like this, I'm learning a lot. The whole purpose of contact tracing isn't just to let people know that they have possibly been in contact with a positive person. The whole idea of contact tracing is to isolate that contacted person, and whether they're positive or negative, it doesn't matter. The whole purpose is to find out who the positive person came in contact with, so they can quarantine and isolate so the virus doesn't spread, so we can stop the damage or stop the bleeding immediately. Now, when you're dealing with 192 cases, you saw the guy's paper, and then to be told we're only focusing on the people that's 65 years of age and over. To hear our contact tracer tell us, I ain't no more even time to go close out the cases I'd work on last week. So all of those people, we don't even know what happened to them. We cannot. The one guy said, no, the lady said, I got a call from someone that said they had not gotten a call from anybody in 10 days. That person is almost PAL quarantined. No one contacted her. No contact tracer contacted her to start the contact tracing with people that she may have been in contact with before she went into quarantine. Now, that's very dangerous, but we're not getting it done. We're not getting it done. So that flabbergasted, dumbfounded, pissed off, because we have heard Dr. Park and Dr. Anderson for months now. In fact, even Dr. Berman on the mayor's show today talked about how we have 50 contact tracers on Kauai is the number I got that's on Kauai. How can we have 50 and Honolulu get 7? And you remember in the news, they had all the National Guard guys. Those National Guard guys are not actual contact tracers. They're helping them screen these names and numbers. So how can the Honolulu get 7, or let's give them, they said a dozen, and Kauai get 50? I don't understand. And I gotta believe that right now, the number of working, I'm talking about working. I'm not talking about people that had passed the online course or went to the sit-down course and they're waiting in the wings for a call from the Department of Health. I'm not counting them because they're not working. I gotta believe, Charlie, we probably have less than 20 people actually working on Oahu doing contact tracing. We saw 7 when the senators made the surprise visit. It's frustrating.
Well, all I'm going to say is this. One has to ask themselves, if Honolulu is the hub, the main center, Department of Health for the entire state of Hawaii, right? If they're like the main locale, with each island having its own like substation, if you want to call it that, to have 50, to say that you have 50 when we had the numbers so low, and they only had 10 when their numbers so high, I would have thought somebody would have said, hey, do you folks need help? What seems to be the problem, right? Because that's what we do. Just like on Maui in the police department, you had a substation in Hana, you had a main station in Wailuku, and then you had a station in Lahaina. If any one of those stations needed help, somebody goes over and help the other one when there's a problem. But not the state for some reason. It's almost like they said, hey, Honolulu, you need help. You're on your own. That's what it seemed like. Okay. So I'm sure, and then, I don't know if you caught on at the interview today, some of these contact tracers, they're not medically qualified because they're tasked with going and collecting samples, the nasal swabs. They're tasked with going out and getting samples from some of the people they come in contact with. I mean, I thought you had to be qualified to do that. And I'm sure the qualification is not, well, when I come out of the shower, I always use Q-tips to wipe my ears. That is not qualifications. So it just is really baffling. It's really baffling. Now, we may have a different insight or look at how contact tracing. My thing with contact tracers is this, and you're right. We identify and we try to stop that strain, that line from advancing, right? What you have to do is you have to throw that net so wide that when you finally realize, hey, I've got it pretty much contained, that's when you start pulling that net together. Because now all you're gonna do is you're gonna maintain those people, see where they're at, see if their illness is advancing, make sure nobody else come in contact, right? Because you got to remind those people, hey, you're under isolation, you've been infected, you cannot have anybody coming over. I know you get family, they're gonna want to meet with you, but please don't do that. If you do, you gotta let me know. Because why? Then it would have gone outside of that perimeter. Then you got to go back out and bring them back in again. And that's what's happening, especially at a point that you made where individuals, this that one individual doesn't even close his cases. You know, ladies and gentlemen, you get people written up and fired from the police department when they investigate a case and they don't close it or they don't turn in a report, they get fired. For that gentleman to make a statement, I feel sorry for him. But brother, are you a long-term career employee for the state that you figure, you know what, this is how we do things? Just to see the conditions they was under. I don't know how you gonna find cases. That one thing looked like the lady's desk was being held up by other cases, like the desk was on top cases. You know, they showed that one, she was in a semi-dark environment and she has her computer on. How do you operate under those conditions? I mean, there's got to be provisions of safety, health and safety. I mean, look like on fire hazard in that place. Come on. You know, if we automated, and then the other thing that really hurt was she said, Park said, you know, I know we got the money, but you know, you folks only looking at this contact traces, but it's a lot of other things. Well, excuse me, Dr. Park, right now, what is more important right now? You got an epidemic that's a pandemic that's running away from you. What would be priority one? To me, would be the contact tracers. To me, bringing it under control. It's not, oh, you know, we get other things like buying office equipment, buying cases of paper, buying toner for the copying machine. No. That's not it.
Yeah, you know, the funding is going to be an interesting question because they got funding for contact tracers. Remember, we got $50 million from the federal government to do testing and contact tracing. That money was allocated to the Department of Health. We have 450 people, according to Dr. Park. I don't know what to believe anymore, but if what she's saying is true, we have 450 people waiting in the wings. We got guys like Brian Ingalls who called and volunteered. A guy that could go tomorrow and start, turned down. We had, in fact, I believe I saw three. I may have gotten 3 comments or messages from people that did the same thing and was turned down, saying that we don't need.
Sharon Snuggs took the course.
Sharon was another one.
Completed it.
But when I heard Dr. Park at the end of the news show, she said, you know, she wanted to thank the Senate committee for coming down because now they can see how difficult it is, and that, you know, it takes money, you know, and they need space, they need supplies, they need equipment. You know, I can't remember who, I think it was either Donovan or Donna Mercado Kim at the meeting, blast her about the convention center. The convention center is sitting empty. There's so much space at the convention center that you could put these people in. This is why I'm so upset. You know, when we were during the period of time where the numbers were flattening, and that is when we should have been prepared or preparing for this moment. We weren't. We didn't do anything. We let this thing go thinking that we were done. We weren't done. Remember the discussions from our leaders about how we were so happy. Beds capacities, everything, hospital capacities were insane. Everything was wonderful. We are ready to open for tourism. And they bought into that. Many of the leaders bought into that, and they started to believe that, and they forgot to prepare for plan B if in fact what is happening now was going to happen. They did not prepare. When we hit the 150, 170, once we broke 200, and we still, no change, 7 people. This is what my biggest fear is, and I don't know, and I cannot wait for Dr. Green to come on. I think I know the answer, but I don't know. I want to get it from a medical expert. Is it too late, Charlie? Because we don't know. We don't have a grasp of the cases out there. You notice the people that are getting positive are people that's getting sick. It's the Kauai case, the guy got sick, and then yes, the contact tracing was able to detect the other person in that person's home, but yeah, that's not contact tracing. My God, that's your housemate. Yeah, that's not good contact tracing. If I got positive and they came and said, "Oh, Patsy got positive," that goes without saying, right? Contact tracing is, Mel, who else have you come in contact with? I mean, who are you sitting next to in the plane? Do you remember talking to anybody in the plane? Did you get close to the flight attendant? On Oahu or whatever island you came from, where did you go? That's effective contact tracing, not, I mean, in other words, don't go praise the process because we found that your spouse or your roommate tested positive. That goes without saying. That's going to happen if you live in the same household. So that is my question. How many cases are out there in that incubation period that we obviously, Charlie, you're almost 65 yet, right? You're not 65 yet.
I just turned 66.
Oh, I'm sorry. Okay, shit.
Nah,
So
not
you
65.
lucky. You a jackass, man. I know you're not 65. So, God forbid you test positive, pal. They're not even going to look at you.
Yeah.
Because you're not 65. Now you who knows where you've been or I've been. So that's my point. I hope we're not at the point where we got so much virus out there in this infectious stages that we're going to be overrun. I'll talk about the hospital situation a little later, but right now, and I posted, if I was the governor today, and I think many of you saw this, if I was the governor, I'd tell Bruce Anderson and I forget her name,
Sarah
Park. Both, I call them in and say you get 72 hours to have this contact tracing up to par. 72 hours, or you folks may as well walk in with your resignation notices, or else you guys are fired. I don't care, civil service, whatever the hell you are. 72 hours, that's what you get, because this is a crisis, it's a pandemic. You get 72 hours, and your time starts now. Get out of here. Because we don't have time for play around with this.
You know where they made the biggest mistake, I think? I would have thought that when we had that lull, that down period, that would have been the best time to regroup, right? Because they experienced the subtle rush before. Now, on one hand, they talk about the CDC guidelines, right? They talk about the models. There are a lot of models out there that showed you, get ready. The rush is going to come. But yet, they weren't ready. So on one hand, they say they follow guidelines. And on the other hand, they say they don't need follow guidelines. Proof is in the pudding, ladies and gentlemen. Where are we now? The other islands they're doing good, but we still have to keep on top of it. But where are we now? I mean, look at this. The mayor has to quarantine himself. The mayor of Honolulu. So what they're telling me is that what is the protocols? I'm going to talk about this more. There's got to be a set of protocols. It's like a fire department. And I always use this analogy. Everybody say, Uncle Charlie, you use all kind examples. Yeah, it's for people that have a hard time understanding. I'm not belittling them. I just want to make the understanding simpler. And that is, when the fire department fought Marco Polo and Marco Polo was on fire, okay, it would have been very simple just to go up the stairwell to the floor and fight the fire, correct? Well, what happened? Number one, Marco Polo didn't have fire sprinklers. Number two, the fire was coming inside the stairwell, which prevented them from going up to the fire, so they had to attack from different angles. But the fire department is prepared because they have alternate plans to meet the demand of the task at hand. The Department of Health did not have alternate plans. All they were taught is we're going to march. You remember the old British soldiers, right? They're marching and they're getting killed at the same time. But they figure, hey, if we go by masses, Some of us gonna make it through to capture the flag, but in the meantime, we're gonna lose about three-quarter of our team. That's what happened when you just march through the same thing, and it's and Mel, you know, somebody that is into football, you get plans. If you keep on running one dive up the middle and the line keep on crashing down on you, you're gonna have to change the plan sooner or later, or you're gonna lose the football game, right? So you change
Yep.
up, maybe you throw one pass. Not this Department of Health. They just kept on charging down the middle and wasn't working. And that's why lay people such as myself, such as the many viewers out there, they were getting tired. Like, what the hell? Because for somebody that didn't understand contact tracing, ladies and gentlemen, you folks out there have more knowledge about contact tracing, really. And I'm gonna pay you a compliment right now. You have more knowledge than the people over there, because why? You were expressing how frustrating it was to say, hey, you were told these kind of things are going to happen, but now again you weren't prepared. How many times can you honestly say you can use that same excuse? I wasn't prepared. I wasn't prepared. If you were prepared, I think you would have had a smidget of success in cutting into this thing. So take the guy that has 192 cases. That's 192 individual cases, right? Some of that 192, 10 might be related, because one who infected the next one. That's another case, right? So take one, maybe get related in 10. Okay, you can put that on the side because they found a strain for that group right there. But what about the next 10? What if that next 10 is all individual contact tracing investigation? Sooner or later, those numbers, as they increase, they start going sideways on you. That poor guy cannot control. Remember, I was talking about bringing it under control. He doesn't have the ability to bring everything back to the center. So what does he do? The only thing he can do, move on to the next case and let this one go to the side. And that's what's happening. Because honestly, can someone tell me down at the DOH, you know, on this date, there was a reported case. Can you tell me if that case has any bearing to any of the earlier cases of infection? Or is that a brand new start? Because if it's a brand new start, then how did it come into Hawaii, correct? Because everything that's there right now supposedly started from one of the cases that's already known. But when you don't investigate enough, you cannot bring it all back to the point of origin. And that's what I kept on saying. In order to close the case out, you bring it back to the point of origin and you said, okay, we got it. This strain, a total of 20 people. That's why Korea can make the claim. Remember, number 31 infected hundreds. They can give you a specific number count because they backtracked and found everything led to number 31. Before 31, there was nothing. There was only 30, but 30 had a different strain. 31 was responsible for all of these cases of infection. We're not even there.
Yeah, and you know, with adequate personnel, you can do that. You that ain't gonna happen. I can tell you, Charlie. And you remember when they talked to the lady? She made a comment about she wished there was a process in place where they could actually sort the cases by the ages, so she could. Right now, I think what they're doing, they're as they make the call, they're learning how old these people are, and if you're 65 or over, you get the priority. So how much time is being wasted? It's a system that is broken.
Yep.
George White just posted, DOH still refusing to baseline test in Kupuna care facilities despite federal mandate requiring it. George, if you don't mind, shoot me a message in Messenger. I'd love to learn more about that. But again, you know, I believe you. I really believe you. You see, and again, I said this from day one when I did my first Facebook Live, that the whole target was to open tourism, right? We know that's what this was. This whole thing was, don't do anything that's going to affect the opening of our visitor industry on back, remember, it was August 1, now it's September 1. That was driving the train. That goal, that motivation was driving the train. And I think that's why the emphasis, the priority, remember, money was never the issue. money was never the issue because we had a lot of it from the federal government. We had the CARES money, we had the COVID funds. So it bothers me when people say when some of these people use the excuse of money, but we know that's what it was, and I think it still is. We in the middle of the worst clusters we've ever had since COVID started, and yet the governor hasn't said a thing about September 1st opening of tourism. No, I mean, hello, right now you put that off indefinitely. I sorry airlines, I sorry hotels, I'm sorry all of you. I trust me, no one wants to see this place open up more than me. I mean, no one. But we got a problem that we got to get a hold of with this current information on the contact tracing, knowing that it's a flop, that we get an F, it's not working. The last thing that we should even be thinking about is opening up on September 1st. We're implementing the inter-island quarantine now. I still question why we're not quarantining on Oahu. I guess they want people to go up and pick up the virus all over Honolulu and then come home and quarantine so you don't bring them around your house. Just stupid. I don't. There is no logic to that. But whatever. My bigger concern is the mainland tourism coming in, but no talk about that. Not zero. There's no. Everybody's worried now about contact tracing. You know, the distraction. In the meantime, airlines are offering 200. I think it was Alaska offering $240 round trips to Hawaii.
Brother, you like hear something? Okay. What is the number one destination with the best pool basically in the world right now? Came out number one, or came out in the top 10 in the travel magazine. Koloa Landing.
Yep.
Ouch.
You know,
Ouch.
we just got to be careful, man. We just got to be careful. Real quick, the hospital situation. I tell you, I had a call yesterday from a nurse from Oahu, stressed out. I mean, I feel for this. I feel for every single hospital employee right now throughout the state. But when you work in a hospital, a large hospital, and when you're at capacity, when your patients are being transferred to other rural hospitals because you just don't have room, when patients are being allowed to go home in a cab because you want to make room for new patients, because these patients are coming in quite often. We got a bunch of sick people. We got a bunch of patients that are on ventilators, all ages. So don't let that crap about only the old. No, we got young people on ventilators. We've seen that with George Ma. We've seen that with others. With your construction worker friend, Charlie. That was young. He was on a ventilator for a long time. When our hospitals are trying to help contact tracers, when contact tracers are saying, "I'm sorry, we just no more time. We don't have enough people." This is what I got. This is not bullshit. This is real. When people call up the hospital and are concerned because their family member is in the hospital, and they're concerned because no one has contacted the household yet, and there's several members living in that same household that the infected person was in, but not one call from the DOH. This is real information. You want to call me a fear monger? Go for it, baby. Go for it. Because you know what? This is the real deal. And when this person, one of the things, Charlie, I don't know if it's a good thing or a bad thing, is we can, just because of our backgrounds, or we can sense the genuineness or the sincerity when we talk to someone. Yeah, I can tell when somebody bullshitting me. I really can. Although Dr. Park pretty much fooled me when she said that we had everybody in place. I can sense the stress, the anxiety, the passion. I can sense the fear. I can sense the fear of this employee, knowing that this person has to go to work and face patients every day. And aside from providing the medical assistance, everything else is not available. The contact tracing not available. The fact that we're moving people all around Oahu because beds are getting filled up. The news don't report on this. This workers cannot go out in a public and tell the world, because then obviously you all know what happens. I understand whistleblower and all that crap, but at the end of the day, you still got to deal with your boss. You still got to deal with your employer. You still got to deal with the retribution. So, that's one of many calls that I have received over the last few weeks. And I feel helpless. Yeah, we can relay the information to the decision makers and to lawmakers, but it's a helpless feeling. Just imagine for a moment that tomorrow you go to work and you work in a hospital, and you show up for work and there's more people there than was yesterday, and you're full and you cannot take any more people, and there's people that are hanging on to their life on a ventilator, and you're helpless, and there's knowing that there's others out there that are infected that have not received the call because this state has failed. And that bothers me. In fact, it really pisses me off, Charlie. It really pisses me off.
Well, I'm looking at some of the comments. Folks, all of your comments are good comments. Yes, you're right. I mean, you can't engage in any of those comments with a denial, because you're absolutely right. I will tell you firsthand experience. There have been times I worked when I was at the medical examiner's office, Department of the Medical Examiner for the city and county of Honolulu. I would be at Queens, standing by, getting ready to investigate a death that came in through the ER. And you would hear, they have all the screens, and it's connected to all the EMS services throughout the entire island, throughout the entire Oahu. And you could hear them say reroute. So ambulance coming in from the east side, from Sandy Beach, with a possible near drowning. Okay, they're floorboarding it to come into Queens. Queens is rerouting to Straub. Straub is saying you need to reroute, go to Palimomi. I've been in those situations before. They keep on telling them reroute because that's all they can do. They're so full at the ER to capacity. They don't have the ability to take anyone in. Okay? So now, as I'm in the ER, I'm with the decedent. I'm getting information from the family. I go out in the waiting room. I look. There's pretty sick people there wanting to get services, but they cannot. They're stuck because the doctors will not let them go in because there's no room. So folks, you see what happens when your health system gets really tied up. And so like one night, I went from Kahuku General to Wahiwa General to coming in to St. Francis West in Eva Beach to Palimomi. Make a long story short, I investigated 8 deaths. And normally you would have to get a death and you would have to go back to the medical examiner's office and go back out and get, no, I didn't have the luxury of doing that. The transporter myself, because we were investigating so much, because timing was crucial. People were there. I had to just make the decision go. I actually came back to the city morgue with 8 deceased persons in the transport vehicle. I had no choice. Did I ever want to do that again? I made it known. It was rough. It was rough. And psychologically, that's why, and the kind of job you get burned out. So I can see, one thing I want to say to these contact tracers is that, either they get high tolerance or they're burnt out and they're just not going to say anything. They're not going to say anything. And I wish, I wish more would have said something. But, Mel, we also have other things that's brewing in the hopper. Today, folks, you had Honolulu Hale, right? They tested over 1,000 people, Dr. Miskovich, because they said it started in some services in Honolulu, and now someone in the mayor's office got infected. And then, of course, we have the cluster that's developing now at the Oahu Community Correctional Center. And that, in and of itself, boy, oh boy. I mean, one would think, and because they're in a confined environment, such as behind prison walls, but it ain't that simple. So we're looking at, we're gonna see. My understanding is today they did a large testing for inmates there, but we can dabble. We can, if you wanted to, we can dabble in some of the knowledge we gained, some of the
Well,
small.
I definitely, Charlie. I wanted to actually have a really good discussion about OCCC, and I think it's, I believe it's public knowledge. Now, I did see a post on Facebook today about, and I'll let you, because you have a lot more insight on that issue, about what happened when, and I saw this, and maybe Charlie, you can expand or expound, where the prisoner came in on a Monday and in fact was tested, and prior to him getting, anyway, I'll let you talk about what I read on Facebook today from a post from a gentleman that was actually in the know, that there was a period of time that inmate was allowed to mingle with others. So I'll save that part for last. I did want to, I forgot to mention HGEA today filed a grievance, and this is kind of going back to the contact tracing. Was late this afternoon. They filed a grievance with the state because of basically, they called it sweat box situations with their contact tracers being forced to work in small, compact areas, which that is dangerous, and being forced to work 6 days a week, but not paying them overtime. That was on the news tonight as well. And again, I think, and what triggered me was when you said, that you said the word overworked. What was that other term you used? Burnout.
Yeah, burnout.
Burnout. When we expose our employees, imagine if your things to do tomorrow, for all of y'all there, your things to do list tomorrow had 192 things that you have to do. You would get burnt out pretty damn quickly, especially if it's a routine calling 192 and trying to create more work for you. So we'll see how that goes. How does the HGA grievance? But my fear is that we're not going to have contact tracers. My fear is these guys are going to go out on stress leave, sick leave. They're going to be burnt out, and we don't have anyone to backfill. So that is really my biggest concern right now, because I believe there's a whole lot more virus floating around than we know of, and that's just simply the way it works.
Yeah.
And I'm very concerned. I'm concerned that this number is going to get to a point. Talking to the nurse yesterday, we cannot take more. The hospital beds are full, and we're still rising. So anyway, I kind of wanted to just touch on that a little bit. But as far as the OCCC, Honolulu Hale, we're going to see where a lot of people work together, close together. That's what's going to happen. Clusters. What was it today? 40 some odd city workers tested positive. About 14 of them was in Honolulu Hale. That's a lot of people in one day. So, OCCC, Charles.
Well, before I do, let me kind of set the story up for you. And Mel, you and I have talked about this already. It was kind of troubling. But folks, what I'm about to say is, and Mel said it earlier, we have been so privileged to have concern, or and in police work we call them sources or informants, that will private message us, and that we respond to it, we look into it. And what I'm going to tell you, it's pretty damn close to what unraveled. Okay. Um, I received a call to look into something because there was, and everything didn't unfold until this past Friday. That's when everything unfolded. But when you hear, when the thing, when the whole situation initiated, it was actually nearly a week prior to. So I went, ooh. So let us go back to a couple months back. We had the early release program, right? Each facility was tasked with looking at a reduction number, letting them back out for now because they were worried about COVID, correct? And yet we didn't have one single case of COVID in the prisons, but we let them out. Fast forward to now, we're seeing these numbers jump both with the prison population as well as the staff being infected. So what happened is from from what I got from the source is that a prisoner was transported to OCCC on 8/3. That's a Monday. And part of the, from what I've been told, part of the protocol has been for all new arrivals that they must go undergo quarantine. But I understand, and I'm still trying to verify this, but they do not have a 14-day quarantine. And that's what makes it kind of screwy. Their quarantine is like 3 days. And I was kind of like, what? This is, yeah. They do not have a 14-day quarantine when for all new arriving prisoners. So I said, okay. So I'm talking to the source. And then when that source left, put me in contact with another source that kind of picked up from there. So what happened is, prisoner came in on a Monday, gets tested. On Wednesday, the test results come back. The prisoner is positive. But yet the prisoner is put with other cellmates in the quarantine module, as they call it, but they're allowed to intermingle with each other. There is no isolation that normally the Department of Health says, hey, you isolate. So right at that point, I started to tell myself, the prison system does not have a quarantine protocol. Because if they did, they wouldn't have allowed that to happen. So that's a Wednesday. Now I'm being all told this information on Friday the 7th. So I asked the source, from the time that inmates' result came back, what did the prisons do? And they said, nothing. And I said, how many people came in contact? Well, the module is, I guess it's set up for 60 some odd prisoners. There's 100 prisoners. At last count, there's 100 prisoners in that locale. Now, I can't verify that. I can ask for the information. They probably won't give it to me. But I'm telling you that I've verified it to the sources that I have talked to who came forward to talk to me about it. And then all of a sudden, you see everyone go into, and I say the prison officials, going into this rapid response and alert. Now they start moving prisoners around in the prison. For what reason, I don't know. But now they're taking an infected prisoner and putting them, or people that was with that infected prisoner, they're going into other locations in the prison. So all one can imagine is now you're just spreading the virus. You're just moving it around, making it harder to find. And basically, that's what happened. So the guard who was actually watching the prisoner, from what I understand, went out because wasn't feeling well. Bingo, comes back positive. Okay, so the question is, how many other staff did that guard come in contact with? Because they knew by Wednesday was infected, but that guard was working with that prisoner from Monday on when the prisoner first came into the prison system. So that's why someone wrote, it's very important that you have, once you find out something, you have between 6 to 10 hours to work it and work it hard. That's the only way you're going to contain this thing. Right now, I anticipate there are going to be more numbers at the state prison. There are going to be more numbers. But it's that kind of, I don't know if you call it negligence, but one, you don't have a protocol. Two, staffing, other than the medical unit staffing, are not equipped with PPEs. Three, you're having workers who no longer feel safe, like in the kitchen, not working. So they're staffing the kitchen with inmates who are sentenced, from what I found out. That means you're letting them have access to knives, forks, and spoons. Is that smart? That's what happened, Mel.
Not at all.
That's what I was able to obtain.
Well, I know a few hours ago they came out and they said that public Department of Public Safety came out and said that as of today there were no more new cases, and yet they're still, they tested everybody. I know that there was on the news last night.
They
Right.
tested
So
today.
yeah, so tomorrow we'll get the numbers. But as I'm looking at the chart, 9 from OCCC. That was just from that one. I would believe would be that one cluster. But the director Espinda, and I'll read this, Charlie, just because I kind of wanted to get your take on this, because I know you have a lot of inside information. He says, I commend our staff for taking swift action with the assistance of the Department of Health as they make every effort to mitigate the spread of this COVID-19 cluster that has formed at OCCC. What is important to note is the facility implemented the PSD pandemic plan to identify the cluster quickly and lock down movement. We are working with DOH on staff and inmate testing, and we are implementing immediate disinfecting, sanitizing measures in the housing and intake areas of OCCC. So, although the headlines say no new cases identified at OCCC, the testing was done today. So tomorrow will be the story. Tomorrow we'll tell the story whether or not and how bad the cluster is. And I would guess because of the close quarters in any of the correctional facilities, yes. I would expect more positive cases for sure.
Yes. Well, I can tell you, number one, there is no PSD response plan.
Pandemic plan. Pandemic. It was
plan.
Specifically to pandemic.
Okay, there was none. Two, the person tested, results were known as of 8/5, but nothing was done until 8/7. So I don't know if the pandemic plan says, let's delay before we react. The lockdown didn't occur to 8/7. So from 8/5, because see, this is what is very baffling to me. We who are free in society, if we have to quarantine, we're being told we cannot violate quarantine. You go to your house, stay hunkered down, have people deliver whatever you have to do. You cannot leave the house. Strict rules. But yet within the prison walls, because we who are free have to make sure we don't come in contact with anybody for 14 days because we're trying to mitigate the spread if we are in fact asymptomatic or whatever the case may be. This person is allowed to move around within those prison walls. That's what I don't get.
The other thing, Charlie, I don't get is if you are a business, if you are Walmart, if you're whatever, a friendly market on Molokai or Maui or wherever, and you have a positive case, you shut down.
Yes.
And you bring in a third-party disinfection team that specializes in COVID, that can disinfect, and they call it deep cleaning.
Right.
How do you do that in a prison? How do you do that? You cannot send everybody home. how does, I mean, how does that happen? That's obviously it didn't happen, but uh, how did? That's why I'm worried about tomorrow's numbers.
Well, I'll put it this way: OCCC did not contract any deep cleaning services. That I know for a fact. And if they did, they must have come in when the prisoners were sleeping, when they're not a threat. Okay, but they did not. The sources I talked to said that whenever you move from location to location, you're supposed to have a disinfection process, right? There is none. So what happens is that when they went into lockdown, the deep cleaning without no proper training, the guards were required to go and sanitize the area of the prison with no training. So basically, they was giving one squirt bottle and rags and just squirt, 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 squirt. I mean, so I mean, Mr. Spender, maybe you got a plan that is so top secret, but I'm telling you, Mr. Spender, the sources who actually work for you are telling me otherwise. So I think people who are following this story can accept if you just tell the truth and then we fix the problem. But you don't make up a story to deflect from the truth of what's really happening. That is not good, because you're trying to build rapport and trust. This is actually going sideways on you, and you'll be joining the Bruce Anderson and Sarah Park hour, where everybody, whatever they say, everybody giving them that look like, no, no, thank you. We had enough of that BS for a while. That's what's going to happen. And I think, that's just my 2 cents on it. Now, someone had asked me, and we kind of get off this subject for a little while, and we can come back to it. Someone asked me about my post that I put about New Zealand, right? So this kind of goes all hand in hand into what we have tonight here on Facebook Live with Mel and Charlie. I put a post about how New Zealand yesterday was their 100th day, no cases, no mask, wide open. Okay. What made New Zealand so different? Because the process, from what I understand, and New Zealand said, yeah, they looked at the model, was to flatten the curve. What New Zealand did was said, hey, we're going to get to every single one of our citizens, and we're going to go into a complete lockdown. It's going to be inconvenient, but if we do it right, everybody will get to enjoy the rewards. And that's what they did. That's why New Zealand can enjoy what they're enjoying now, because their people knew that if they went and they sacrificed really hard, everything would be flattened to the point that they can go back out. They don't have to wear masks. They can do everything they want to do. Okay? Yes, they do. They have their borders closed off. Like we can't do that. But nevertheless, they were able to control the spread from within their boundaries. And everyone sacrificed, and it worked. So what my post said is, you get all these guys that are these rights saying like, I have the right to do this, I have the right to do that, that's my rights. Guess what? When we relaxed on the rules and we opened things up, some people went bonkers. And guess what happened? The numbers went climb. So you can disagree with me. It's okay. But guess what? I'm not the decision maker. The decision maker right now relies on numbers. And as long as the numbers is high, we are going to be where we are now. Because we're one close step to having a complete shutdown. So either we make it work this time, ladies and gentlemen, or we will face that. So that's why a person had asked me to explain about my post. That's what I posted. And that's the truth. New Zealand said, hey, if we can sacrifice now, in the end, we're going to be able to enjoy. And that's what they're doing. They're enjoying the spoils of what hard work they did. Reason why we can't enjoy it because the majority of us was following the rules, but it just took a few to screw everything up. That's all it did.
Charlie, I just want to recognize Congresswoman Tulsi Gabbard is on. She just came on. She says, "Aloha, you guys. Thanks for keeping up your weekly talk show live sessions. It's nightly, Tulsi. It's every night. And like I said earlier, nothing happens by mistake. I was actually going to give you a call tomorrow. I'm not sure where you're at, if you're in DC or here, so to jump on, because I understand that you might have some involvement in what we're talking about. Wink, wink. So anyway, expect a call from me tomorrow, Tulsi or Congresswoman Gabbard. We'd love to have you on the show this week if possible.
Yes, yes, for sure.
Very, very instrumental in what's going on some of the things we've been talking about tonight. And real quick about New Zealand, the bottom line is you hit it, Charlie, the lockdown. We're a society that is impatient, and oh, I'm in Hawaii. All right, perfect. Let's talk again soon. I have some thoughts to share in caps.
Oh yeah.
Well, how about we do this, Tulsi? I'll call you right after the show, but try clear your calendar tomorrow night at 7:00. How's that? That'll be fun. Gosh, that's like bizarre. I was gonna call her tomorrow, Charlie. I shit you not. Oops, cannot swear on this show. I forgot.
Damn.
But anyway,
shit.
the
Damn.
shutdown. The shutdown is the key. You had surgery. I had surgery. When you get surgery, there's a plan about how long you got to leave your staples or your stitches in, right?
Yeah.
There's a plan. I remember when I was young, I was playing football. I hurt my ribs. There was a plan. The doctor said, "Hey, you cannot do anything physical for X amount of weeks or months or whatever." It seemed like months when I hurt my ribs. But I felt good. I felt like, I remember, I feel good. My uncle had a fishing boat at the time. He said, "Hey, we go fishing." I knew I'm not supposed to go fishing because I wasn't at that time. My ribs weren't completely healed, but it felt good. I could breathe. If I coughed and I didn't feel any pain. So I said, okay, I'm going fishing with my uncle. My uncle had a rule on his fishing boat that he does not turn around. Sick, hurt, whatever, unless, of course, if you're dying, I'm assuming he would turn you around, but turn the boat around. But I remember as soon as we got outside, went out Nawili Willie Harbor, right outside Carter's Point, heading towards Black Mountain, we hit one wave. Bah! My ribs. I thought I broke my ribs again. And I could not tell my uncle, "You okay?" I said, "I'm fine." I couldn't breathe. I told him I'm fine. He did ask me if I wanted him to turn around. I said no, because I didn't want to ruin a day of fishing. I suffered that whole day on a boat, hours. My point is this: we locked down. We had the injured ribs. We locked down. Then we started to feel good, and we went on the boat. Hawaii went on the boat before the doctor said he should. And guess what? We injured the ribs again. But we're not learning. No, we're not.
Yep.
We're still going fishing. We're still playing football. We're still doing what we're not supposed to do because we're an impatient society that is more focused on bringing back tourism than the health and safety of our people.
Yep.
And that is why I am frustrated. We must be patient enough to, the sacrifice that we went through with the lockdowns and the stay-at-homes and all of that. We need to be patient and let that run its course so we can, as Charlie says, scrub the virus. And as long as we keep going back on a boat with the sore ribs, the ribs will never heal. And we're going to always be a prisoner to this damn virus.
Yeah. Unfortunately. It says, please email Tulsi office at mail.house.gov with your number so we can edit, or she's responding.
She's responding to somebody. No,
But
I'll give her a call. I'll give her a call right after here and try to get her on. I know
Yep.
I know she has a lot to say. as she
Yep.
winds down on her term in Congress. Man, I'm kind of disappointed.
Yeah. Well,
But
I also like to say that again to our faithful viewers, and we see a lot of new names that's been joining in. I cannot express my personal gratitude to all of you. You know, we do this for no compensation because it's a desire. For me, all of you already know, and for the ones that just jumped in, you folks all know that I'm doing this because I lost my brother to COVID. There are always people out there that are going to rely on numbers of deaths, numbers of deaths. Okay. And maybe there are more numbers of deaths involving the flu than there is of COVID, if that's how you want to look at the numbers. Is because some of us is taking this damn thing so seriously. We're trying our hardest to make sure that we have no more deaths. We're trying our best. But when you get, like today, when you get another death or two deaths that's reported, one is one too many. Because I always ask myself, you're given this timeline of life, right? Life expectancy. Do you think it's fair to cut that timeline short because you got COVID? If you're supposed to live into your 70s, why fool around and run the risk of maybe living to your 60s because you caught COVID? I don't think that's fair. But if you think that's fair and you want to do that, then fine. I'm not going to argue. But what about the innocent people out there? The ones that we come in contact with that we don't know we're carriers, we're asymptomatic, and we pass it on to them. Was it fair for them to catch the COVID from us? To me, that's now we're not talking about what's fair and what's not fair. We're talking about selfishness. And someone's selfishness is going to cause undue harm to somebody else. So that's my whole point of why I do what I do, and I enjoy being on with Mel. And some nights we get some good nights, some night we get some hard nights. Tonight is one of those nights. We ran a little over, but tonight is one of those nights where we're just gonna hit it right between the eyes because, damn it, this thing is real, and I don't care what any of you think. Me personally, why I don't care, because we're at war. I don't care what anybody says. We are at war. Because if we weren't, guess what happened? Everything will be opened up by now. But it's not. So that means we're at war. Got to take it seriously. We got a lot of good people that's on this threads tonight and giving a lot of good information. So, folks, when you have a chance to read them, read them. Because what? It's always good to share. And like Mel and I have always said, we inform and educate. What we bring on, if you can use it, fine. If you can't use it, toss it on the side, move on. Let's go to the next subject. But we wanted to talk about how people are coming forward, giving us messages, giving us the inside scoops of what's happening. Now, those prisoners, yeah, they got to pay their time to society for what the crime they committed. But you know what? They shouldn't be sitting ducks either with COVID. They shouldn't be subjected to themselves because they can't move. They're stuck in a cell. But you know what? The damn prison should not be putting an infected person with a person who's not infected and letting that person get infected too. It just doesn't make sense, and it's not right. It's not right.
couldn't agree with you more, my friend. Couldn't agree with you more. I think, Charlie, you brought us along your journey with your brother. I think most of us on this call, on this show, has been on since the beginning, and
Yep.
you made it personal for a lot of people, and the frustration is that when people, decision makers, it's not personal for them. And I don't ever pray. I know a lot of people say, oh, they're going to change when Ige's family get them. Please, I ask God every night. I pray to God every single night. Do not lay this virus on anyone. But it's frustrating when you have friends and family that have been touched by this virus, and yet the solutions don't seem that difficult. You know, when you're talking about whether it's contact tracing or when you're talking about quarantining or when you're talking about enforcement, you know, I mean, the solutions, especially when we've had the models like South Korea, like New Zealand, like Australia, all of these countries that have been successful, we have a lot of models to follow. But Hawaii, for some reason, felt that we could create our own model. And it's called the half-ass model, that we don't have to go 100%. We can take a little bit of what Korea is doing. We can take a little bit of what New Zealand is doing. You know, you cannot do them that way. You find the model that's working and you copy the damn thing 100%. You tweak a little bit for cultural reasons or whatever, but at the end of the day, you cannot take one part that works and expect that to be the solution. It bothers me, because again, it's not too difficult. I remember when the show Charlie and I said, just give me and Charlie 4 hours. We put together the plan. I only need 4 hours. And really, the only thing I would need 4 hours for is to make sure we comply with the legal requirements of our laws.
Hmm.
But the actual practice of the objective would be quick. It's just the formalities would take the time.
Hmm.
But you know, no one listened. No one listened. I mean, and when I talk about no one listening, I'm talking about our leaders. And believe me, they are hearing us. They're just not listening. And not that we are smarter than them. No, man, we just been blessed to have a lot of people like you all come on and give us suggestions, resources to go track down, read. And yeah, we know there's a bunch of people on this that come on and watch just to be critical, scrutinize what we say. That's fine too. I trust me. I respect every single one of your opinions. I really do. And at any moment, if I saw convincing evidence that what we're talking about is not right, I'd be the first to say, you know what, I was wrong. I was wrong. But what we see today, the proof that we see, the evidence that is coming forward now is scary. And now we're asking intervention from Congress, from those people in DC to come take a closer look at what's happening in Hawaii, because people are at risk and we got 3 deaths or what is it, 5 or 6 deaths in the last week in Hawaii. And some people will say, well, Kauai no more virus. Well, you know, remember Utah didn't have virus either. And in 2 months, they got just blown apart. So I worry for everybody. I care for everybody. And I want to make sure we get through this with the least amount of casualties as possible. And I just hope, I hope we can make it happen. But anyway, it is, Charles. Man, it's 8:12 already. I'm sorry, went a little bit beyond, but
I do want to answer one thing. You know, someone asked, please explain to the people why our borders of Hawaii can't be closed. Do you know the official answer, Mel?
as far as our borders, meaning like for travel,
Yeah, preventing people from coming in.
because our
Yeah,
constitution, our
The
constitution
right to travel.
prohibits, yeah, prohibits us from blocking travel. Now, you know, let me just spend 1 minute on this because it is a very important topic. Early on, remember early on, the 4 mayors, or 3 mayors, Harry Kim didn't do it, and I think that's why he lost the election. And I'm really serious. I'm not making fun. I just think he lost the election because of how he handled COVID when he refused to sign that letter to the president. But the 3 mayors did, asking the president asking the governor to sign a letter to go over to the president of the United States to give consideration to Hawaii closing its borders. And the governor refused to sign the letter. And he made the excuse as that it was a waste of time. I don't know how long it takes you to sign a letter. For me, it takes about 3.2 seconds. But he said it was a waste of time because the FAA and all these excuses of why it couldn't happen. I believe that if we had a collective effort from our county councils to our mayors, to our state legislature, our House and Senate, the governor, our congressional delegation, you see what the president closed the borders from Canada and Mexico from the contiguous United States. He did that early on, and it's still closed today. I believe if we had put that concerted effort, we could have gotten some consideration, maybe not a complete shutdown, but we could have had some changes. So that is the reason. I'm still pissed about that as well, but that's water under the bridge. We that's not going to happen with this governor. And I'll never forget that when he came on TV and said that it would be a waste of time for him to sign that letter and send to the president. Wow. Wow. But you remember, what was the focus? And you believe me or not, I don't care. It was always the priority of the governor, our governor, to accommodate tourism over the health and safety of our people. And by him sending that letter would have been a huge detriment. It would have sent a horrible message to the visitor industry, and he wasn't willing to do that. And God forbid us getting into a situation like New York or Arizona or Texas. But listen, we are no different than those guys. The fact that we are an island state gives us some protections on the neighbor islands, but what happened in Arizona and Texas, Southern California, in New York, in Florida, can absolutely happen here. Call it fear mongering, but we better be prepared. And the preparation has to start 3 months ago. We're way behind. So anyway, I hope I answered your question.
Well, I did want to ask you, since we're I apologize, folks, but I'm going to keep on asking some questions that's popped into my head. But I'm going to ask you this question. First, I'm going to preface it by saying, early this morning, a conversation went on with some noted experts, one from England, an intensivist, and also an expert in epidemiology as well. The New York epidemiologist or virologist, I should say, and as well as another expert from the University of San Francisco. I believe his name was Dr. Alan Wu. So when the moderator first brought on Dr. Wu, the first thing he said was, before I begin to answer the question, I would like to take this opportunity on behalf of my profession, doctors, anyone that wears a white coat, who works in a lab. I want to apologize. And I was wondering, why was he apologizing for? And he said, I am apologizing because in our profession, and we provide lab results, our labs were not able to keep up with the demand. I want to apologize. I thought that was so cool of that guy. I mean, he stepped up to the plate and says, I'm sorry. I know a lot of you have to wait, because the next question to that was, the virologist from New York said, from a viewer, I got tested, I was negative. A couple days later, I got tested again, but I had to wait nearly 14 days, 2 weeks to get my results back, and I was positive. You know what the virologist said, Mel? They said, that's utterly nuts. You wait that long, the results have no use. It's no use already. So, so the point I'm trying to make is, here you got a doctor coming on national syndication, right? He can apologize. I have not heard one apology from Dr. Park or Dr. Anderson, because you two know you screwed up. I would not be jumping on you, because I would be on your side if you just say, you know what, I think we missed the ball, we calculated wrong. I can handle that. But you still go day to day, making as if, not my fault. Even when they interviewed Sarah Park and they talked about all the money. No, that money, you don't realize the money got to be, hey, is that your response? That's a pile of crap. I wouldn't be responding like that. You ever heard of the word humble? Eat humble pie. That damn person gotta learn how to eat humble pie. And I think that's the problem. Because you show not one sense of being humbleness. Because why? If your plan was working right now, we wouldn't be in this damn position that we are right now. And that's what's pissing me off the most. Learn how to be humble. We can all move on. We can all accept it. Okay? I'm sorry to say, even a governor, I never hear one word of apology. Maybe it's not, maybe in the code of governorship, when you get to be a governor, never apologize to anybody. Well, I've heard other governors apologize, and you know what? People rallied around them even more because why? They're starting to look human. They're starting to look real. When you don't apologize or you don't admit you're wrong, then people will look at you like, "Hey, you a real asshole." And that's terrible. I mean, I don't know you, but I sure would hate to go through life being known as an asshole, especially when you're in your last term. Now, I'm not saying he's an asshole, but that's just the image that you throwing out there. And I know you're laughing about something now.
At you,
I'm
at
sorry.
you.
I said I would never swear, but maybe you and rub off on me. That's why I don't
Oh,
know.
perfect, because you just said make up for the last 4 months right there in that short 3 minute. Amazing. No, but you see the frustration.
Yeah.
I gotta agree. I mean, when Dr. Park was in the COVID committee, and they were telling her, basically guiding her, setting her up to accept some responsibility. She just chose not to. Um, she still insists that it's really the people's problem, that the people are not wearing their masks, and absolutely no responsibility, none, for the fact that their contact tracing program is a failure. And you're right, Charlie. I would love to have heard some kind of accountability, some personal responsibility. I don't get it. I don't get it. I'm not sure what the what why. I think, like you said, I think we all would would be empathetic and supportive if they came out and just be transparent. And exactly, Charlie, why not just come out and say, we didn't expect this to happen. We just didn't, and now we ask for all of your support and apologize. But that ain't gonna happen. That is not gonna happen. If it hasn't happened already,
Hmm.
it's just bad. I did want to cover one more thing, Charlie, before we leave. I
Yes.
know I've been getting a lot of questions about the quarantine exemptions. I
Yeah.
have had today. I got information about executives, hospital executives that have gone on vacation trips and been granted exemptions when they come back. Don't have to quarantine. This whole program is not going to work if we allow exemptions that are not legitimate. Um, I heard the mayor anyway, because the quarantines for the exemptions for Kauai will be granted by it's a state process, but it goes to the county. I posted the link. If you haven't seen it, I'm going to post it right now. This is the um, this that link looks weird, but that's the link to apply for your quarantine exemption for essential travel only. If you're going on vacation, I don't care if you're an essential worker. I don't care if you're a doctor. I don't care if you're a nurse, a dentist, whatever. If you're not traveling to do your essential duty, then you don't qualify for an exemption. So don't even try. Be true. Be real. Be not. Don't be selfish. If you got to travel for work, then and if it's essential work, then you get an exemption. But it doesn't allow you free reign to go wherever you want. You still got to come home, or you go to work, and when you're not working, you got to be at home. Let's all work together to kill this damn thing. And so anyway, I posted the uh, link. If you guys have any questions, go to that link and make sure you follow the rules. I disagree with exemptions right now. I disagree with exemptions. I think that's the flaw that can re-engage a virus. I really do. And I don't like sound like one hard ass, but remember what I just talked about, being patient. And let's scrub this island once again. Let's scrub this state from the virus. It's not going to happen if we're granting exemptions because I know who you are and you're an important person. And I really don't care what your job title is. If you could be essential, but if you're going on a vacation, you're not an essential traveler. You're a vacationer, and you shouldn't be getting an exemption. So,
I think the question should be asked: if you got an exemption and you become infected, does your exemption get get rid of the virus any sooner because of that exemption?
only if there was signed in black ink. If you use any other color ink, then you're just as susceptible to the virus. This virus doesn't discriminate.
Thank you, Dr. Phil. Thank you.
I'm gonna need Dr. Phil pretty soon.
Dr.
All right,
Phil,
I
Phil.
just got Tulsi cannot come on tomorrow night, but Thursday or Friday should work. So I think we should forego our town hall Thursday
Yes.
and bring Tulsi on Thursday.
Oh yes, that sounds like a plan, my
Bingo.
friend. Sounds.
So we'll have. I tell you what, Charlie. Unless something drastically changes tomorrow, like maybe we get 0 cases or something like that. Let's do a town hall Tuesday.
Yep.
How's that?
That can work.
Let's do a town hall Tuesday tomorrow, and then we'll have the lieutenant governor on Wednesday,
Yep.
and then we'll have Congresswoman Tulsi Gabbard on Thursday,
Yep.
and then Friday.
I want to get Dr. Miskovich only because he's been so wrapped up with testing. I want to know how that's going because, if I'm not mistaken, the last time he was on, he can assemble a team, lickety split, right?
Yep.
He can assemble a team of a couple hundred to do a mass testing. I mean, it's amazing how he does it. So I would like to bring him on. That'll be
Okay. We'll send the invite out tomorrow. He's been very good. Unless he's doing mass testing somewhere, we'll try to get him on for Friday. So how's that line up? Tomorrow, town hall Tuesday. You know what? I really want to hear from people that have stories, good stories, stories involving COVID. If you know of some good stuff that's happening, let's try to shoot for some positivity. But also, if you have some information that could help raise awareness for everyone else, we'd love to hear from you as well. So same rules. We'll post up the link tomorrow, and anybody want to join us on Zoom, we'll bring you guys on. How's that, Charles?
Well, I also want to make a plea out there to any frontline nursing staff on any of the islands who is working frontline COVID. Please message us in Messenger if we can get you to come on. I beg you, because I think us who are not trained medical people need to hear from people such as yourselves what you're doing, because I'm pretty sure there's some compromising going on with your family life, because I'm sure you don't want to bring the virus home to your family. So it sounds to me that arrangements are being made that while you're on duty, you folks are maybe holding separate quarters or something like that. So I think if there's anyone out there, an RN, please, and you work at any of our hospitals and you're working the COVID response at those hospitals, I would love to have you come on and you share your story. Okay, I would love to have you come on and share a story.
Awesome. So tomorrow night, Town Hall Tuesday, we'll have some fun tomorrow night. Just so all of you that donated to our Keiki Shield, we didn't steal your money. We have over $5,000 that we raised. We're just waiting for the shields to come in. Dr. T is it's in high demand, so as soon as it comes in, we're going to have the distribution out. But I just want to let you guys know that because of your generosity, we'll be giving 600 Keiki masks out to kids that can't afford it. So I just wanted to make sure you guys didn't think that Charlie and I had absconded with the money. No, the money is sitting safely in my bank, getting about 0.000001% interest, and just wanted to thank you guys all for that. So with that, tomorrow night, Charles, 7 o'clock, it'll be fun.
Yes. Looking
Charlie, as
forward
always, thank you so much, bro. You know, man, I love you. I love your wife. I love what you guys do and your passion. And man, I
love you
couldn't
too,
ask
my
for a
brother.
better partner for doing this show. And to all you viewers, again, there would be no Mel and Charlie show if not for the viewers. So thank you all. We'll see you guys tomorrow night at 7 o'clock for some fun. Remember, Wednesday, Lieutenant Governor, Thursday, Congresswoman Gabbard. Wow, back to back, Kanak attack, false crack, heart attack, something like that. See you guys tomorrow night, 7 o'clock. Love you guys. God bless.